I want to talk today a little bit about hysterectomy. So, hysterectomy is performed probably in the top 5 surgeries within the United States on women. So, it's a really, really common procedure, but I still think there's a lot of unknowns about what exactly a hysterectomy is. When you think about just the name hysterectomy, a lot of people don't really think about that it means to remove the hysteria. So people have correlated the uterus in women with causing us to be hysterical. A little bit ludicrous, I think. However, that's where the name comes from. Now that we have all these different treatment options available to women for the heavy menstrual bleeding, the number of women who need hysterectomy has actually gone down. We're able to treat it with other methods. But let's say that you have a really big uterus with a lot of fibroids in it. Hysterectomy may be the only option for you. And in the traditional sense, the way that these were originally done, this was a major surgery. You might have been in the hospital for like an entire week and then resting for 2 months. We have made huge strides, and it's not that way any longer. So instead of making an incision on your abdomen or even going through a more advanced route through the vaginal canal, we perform most of our hysterectomies, myself included, through a laparoscopic and minimally invasive approach. What this means for the patient is a much faster recovery, a much shorter hospital time, less bleeding, less chance of infection, and overall just more cosmetic appearance to your surgical incisions. So let's talk about hysterectomy, minimally invasive, so you understand what that means. So you would come into the hospital, we would put you to sleep under a general anesthetic. Since the abdomen does get filled with a carbon dioxide gas, we need you to be nice and numb. So you have to be asleep. We can't perform this under a local. Once we make the initial incision, which I do right into your belly button, and it's a really small incision, just the size of an eraser head, your abdomen becomes a large tent. I can then find a few access ports in your abdomen to put in these additional ports that are equally small in size, and most of the time I can get the surgery done with just 3 very small incisions. Through those ports, I utilize instruments that can burn and cut the blood supply to your uterus all in one movement, and it allows me to separate the uterus and the cervix from the surrounding tissue. We then utilize the opening of the vaginal canal to take the tissue outside of the body. If your fibroids are particularly large or your uterus is particularly large, I might actually have to go down to that area and use my hands with a scalpel to remove those pieces of tissue. There really are no limitations technically on how big of a uterus we can do this way, but the bigger the uterus is, the longer it might take me to take the pieces out. For me, that does take a large amount of patience, and you might just be taking teeny tiny little pieces out over and over and over again. It could take an hour, but for you, it means you're probably going to get to go home that same day, and that's what's really the most important part. It's most important to me that your surgery be done in a very minimally invasive way that is very cosmetic, that allows you a really great recovery, because we don't want you to be down for a long time. And the best part is you get to go home later that same day. So most of the patients will only spend about 6 hours in the hospital being recovered. We check your blood counts, we check your vitals, we make sure that you're not nauseous, that your pain is under control, there's no signs of bleeding, that you can empty your bladder, and your family members can take you home to rest. The minimum amount of time you'd want to take off your job is 2 weeks. We wouldn't want you to go back too soon. But if you have a job that requires really heavy lifting or strenuous activities, maybe you're a fitness instructor and you're going to be jumping all day long, we would recommend you take off a little bit longer from your work. Hysterectomy doesn't mean you're going to get hysterical. Part of the reason I think that used to really be said is they used to always take woman's ovaries out at the same time she had her hysterectomy. For most of my patients, they're still premenopausal, and the ovaries are still providing them with all of the hormones that their body needs. And unless there's something wrong with your ovaries, I highly recommend you leave them inside. It'll be a much better transition into menopause later in life if you leave them in place. And taking out the uterus does not mean we have to take out the ovaries, and it doesn't mean that you're going to be in menopause. Your menopause will still occur at your natural time it would have. You just won't have the thing that bleeds or hurts or cramps anymore, which will improve your quality of life greatly. Another recommendation that I make when you have a hysterectomy done is to have the fallopian tubes removed. A lot of people may not understand how that might give them a health benefit, but we've learned over time that almost half of all ovarian cancers actually come from the fallopian tube. So if we take out the fallopian tubes at the same time we take out your uterus, I'll cut the chances in half in your lifetime of ever getting an ovarian cancer. And that really provides you with a huge health benefit. The other thing that has to come with the uterus when we use this technique is the cervix. And I do get a lot of questions for women about how that might affect not only their sexual health, but also their bladder health. So one of the things that's important to do in the technique is to not cut the pelvic support ligaments. So we're able to use our instruments to make a small circular cut around the cervix above your pelvic floor. And I like to explain it like a sink with a drain. So we don't cut any portion of the sink, we just remove everything out the drain. So your pelvic floor is the sink. And after we've taken the uterus out, nothing should be falling or moving, or it shouldn't change that anatomy at all because we no longer cut those ligaments that hold everything up. There are some women who do describe sexual changes after having had a hysterectomy, and primarily what they might not feel anymore is the contractions of the uterus when they're actually having an orgasm. So for some women, that might be a negative against getting a hysterectomy, although most women will describe their experience as not missing that over time. So your body can adjust, and it can still have an excellent sexual response through orgasm through the other glands of your pelvic organs, such as your clitoris and your G-spot. So your cervix shouldn't be required in order for you to have an orgasm, but you will no longer be able to have any type of that squeezing sensation that the uterus might provide during sexual stimulation. So that's just an important thing for you to talk about ahead of time about how much that might impact your sexual health.